That's right, I'm Rhys. I'm from Maurice Blackburn Lawyers and I work for the Superannuation and Insurance Department. So what we do there is basically provide information and help people access disability insurance if they've had to stop work because of an injury or, more importantly, an illness before they reach retirement age. So obviously very, very valid information for anyone who has CF or has kids with CF. And my first introduction to cystic fibrosis was through a social worker down in the Alfred Hospital down in Melbourne. So this social worker is absolutely brilliant and she loves to think outside the box in terms of how to help her patients. So through that, we actually got an invitation to go in and see some of the CF patients on the ward there. Most of the time they're in some pretty serious situations in terms of their health. So life and disability insurance has been a pretty common factor in superannuation for quite a while now, and some of the key differences with insurance through your super as opposed to going out and seeking an insurance policy for yourself for life and disability and to cover your family comes down to a few things. First of all, you're paying it with pre-tax dollars, which is always handy. Also, it's relatively cheaper than a standalone policy, so one that you would go and organise for yourself. So even with the fee hikes that you might have seen in the media recently, there's still very cost-efficient ways of getting disability and life insurance. Now, the way it works is that your super fund will negotiate with an insurer a group life policy for its entire membership, which means that when you're looking at a fund like CBUS, who has hundreds of thousands of members, all willing to pay a premium for that insurance, the fund has a lot of buying power. So they can get good cover and negotiate that with the insurer. So it's a lot better than you can do by yourself. And another thing that group life policy does, which is really important, is it spreads the risk. So you're looking at 200,000 people as a membership. There's only going to be a small percentage of those people who actually ever have to make a claim for disability or life insurance. Most will live until 65, and in most cases the insurance stops at 65. You've reached retirement age, you no longer need to be insured for a loss of income if you stop work. So most people reach that point, meaning there's all those premiums being paid with no claims, so there's a lot less risk for that insurer. Now, the other thing that eventuates from that spread of risk is what is most important, I would say, to people with CF, and that's that the insurers, through the fund, can offer default automatic acceptance cover, meaning rather than having to fill out a questionnaire, disclose your history, your parents' history, those sorts of things, purely by joining a fund and being a member of that fund, you get that insurance. There's a few, I guess, caveats on automatic cover. First of all, there will be some fine print, but it's usually along the lines of you needing to be at work doing your normal hours and your normal duties on the day you start that job, and that should coincide with the day you join the fund. Some policies might say that needs to be maintained for a number of months, but for the most part, if on day one, when you join the fund, you're at work doing your normal duties, then there's a good chance that you've got cover, which will cover you for pre-existing illness. So there's been a few changes in recent history around super, which have all been really good for pretty much all the workers in Australia. So My Super came in January 2014. Now that's a legislation whereby if someone starts a new job and they don't want to specify where their super goes, they just tick the box that says, okay, my employer would like to put this money in Host Plus, for example, and I'm happy with that. I'm not going to choose a fund. If that's what happens, it must be a My Super account, meaning a number of things. Firstly, there's no commissions, low fees, it's a fixed investment, which is all very interesting, but more importantly, it must have default life and disability insurance cover. Prior to My Super being introduced, life insurance was the only mandatory thing. Since January 2014 though, you start a new job, join on that default fund, then you will get that cover. So that's obviously a really important thing for anyone entering the workforce or changing roles. But you can actually do better, and through Super Choice, which is actually introduced in 2005, you can choose a fund. And by doing some research, looking into what funds offer what insurance, you can potentially direct your funds into something that provides the best cover for you. There's different types of insurances within super. There is the life insurance, but within the disability components, you do have a TPD, total and permanent disability lump sum, and you also have an income protection, which is your month-to-month payments if you can no longer work or you can't work for a discrete period of time. So depending on your health, depending on your situation, an income protection can be quite beneficial if you need to stop work for 6 months for health reasons, but then it's likely you'll be able to return. Whereas a TPD insurance, total and permanent disability, it's a lot more stringent a test. It's a lump sum, but it means that well, the definition for TPD that you have to meet is that on the balance of probabilities, you will not be able to work in anything you're trained, educated or experienced in because of injury or an illness. So immediately you can see with the TPD insurance that it's a much more stringent test, but there is some wiggle room there, because education, training and experience are very important in this definition. If, for example, you were a truck driver with a back injury, you could no longer drive a truck, it's all you've done for 20 years, just because you might be able to go and work in the family's fish and chip shop, it's outside of your training, education and experience, therefore you can still have potentially a TPD claim. A few things, I guess, nuts and bolts. Income protection is a monthly payment. It will usually, through super, cover you for 75% of your previous earnings. There's a 1, 2 or 3 month waiting period depending on the policy, and most of them will pay for about 2 years. Some will pay up to 67 though, so it really depends on what fund you're with and what insurance they've negotiated on their members' behalf. Now, income protection's offset dollar for dollar. So unlike your TPD claims, where you can have multiple claims, you can really only have one income protection claim, even if you've got multiple policies, because each dollar you get paid in will offset against each other, meaning you'll only ever end up with 75% of your previous earnings, regardless of how many policies are paying. I guess remembering that 75% is a really important thing as well. We had a nurse who came to us after ceasing work thinking that she had cover for around $3,000 per month, but we found that while she did have that cover, and she'd actually changed that cover from $850 per month several years beforehand, she's increased her cover. Now, she got back to work, hurt herself at work, was off work for a number of months, and then returned to work part-time. Worked part-time for about 3 years, on about 2 days a week, meaning that 75% of her previous earnings was calculated off 2 days a week. So the $3,000 she thought she would have per month is far from what actually came to reality. So once again, she had enough knowledge about super to know that she was underinsured and she could increase her cover, which, the same as any other type of insurance, you can do through super. She was fit and well and didn't have any trouble with increasing cover. Normally, if you do increase cover though, you will be asked to fill out that health questionnaire and let them know of your pre-existing conditions. So in this case though, she had a bit of knowledge but not enough to know that reducing hours can actually impact her income protection payments. Now, it doesn't have the same effect on your life insurance or on your total and permanent disability insurance, but once again, it's pretty relevant if your health is heading to the worst and you need to reduce hours, or you're thinking about stopping work, that you make sure you know the impact that that will have on your financial situation through insurance.
In that situation, you're saying that it'd be better off for someone not to work at all?
No, certainly not. Look, we would, through our role at Maurice Blackburn, we're there to give you the facts, explain to you what's available to you. In her circumstances, returning to work was what she wanted to do. And it kept her as part of her work social group, and it kept her as part of the community, which is incredibly important. But a hypothetical for that situation, the fund she was with had a waiting period of 1 month. She was off work for 3 months, and the cover, the insurance, was 75% of her previous earnings. So feasibly, after a month of being off work, and remember she was off work entirely for 3 months, she could have made that claim. She could have been on payments, and even when she returned to work 2 days a week, potentially she could have had a top-up of up to 75% of her full-time wage for ongoing, because the policy she was on paid to 67. So with the right information, she would have been in a far different financial situation. So stopping work, that's an individual choice, and absolutely staying part of your workplace and part of your social circle and your community has a huge impact mentally. So we would never advocate that if you're capable of doing it. But it's important to know the impact of reducing or stopping work. So that's certainly what we're here to inform people of and answer those questions. Life insurance. So there's a few things around life insurance through super that a lot of people are a bit fuzzy on in terms of where your super goes if you were to pass away. Some people feel that if they stipulate that in their will, then that's what will happen. But superannuation is actually outside of estate law. And the super fund is actually, or super trustee, sorry, is obliged to pay your death benefit, which can be your account balance and any insurance that's also part of your super. They're obliged to pay that to someone who's classified as a dependent. Now that can be your spouse, your de facto partner, it can be your children, someone who's financially dependent on you, or someone who's in an interdependent relationship with you. So that could be a carer type relationship, or even just someone who you live with and depend on equally in terms of getting through the day, finances, those sorts of things. So they're obliged to pay to these people, or someone who fits that category. You can make nominations. So a lot of you might have seen that you can make a non-binding nomination or a binding nomination through your super statements, those sorts of things. Now, a non-binding nomination is exactly that. It gives a super fund a name so that if you were to pass away, they'll call that person, send them the relevant forms, and in those forms they'll actually ask, are there any other potential claimants on that death benefit? Are there any other dependents? So then the fund will investigate that, and they could pay it to one person, they could pay it to a number of people if they find that there are worthy claimants for that. Now, you can also make a binding nomination. So if you make a binding nomination, the super fund, if that nomination is valid, will pay your death benefit to that person to the exclusion of all other people. So that person still has to be a dependent at the time you pass away, meaning the spouse, de facto partner, children, financial dependent or interdependent. So if it's a non-valid binding nomination, then it will be nullified and the super fund will have to go through that whole process. Now, the only other way to make sure, most importantly, that your super gets paid to the lost dog's home or the cat's home or wherever it might be that you want that money to go, is that you can make a binding nomination to your estate. So if you make a binding nomination to your estate, you can then stipulate where that money goes through your will. So that's certainly another option. And importantly, if the super fund cannot identify a dependent that is suitable to have that benefit paid to them, then they will pay to the estate as well. So that's where it will end up if they can't identify that person. So, terminal illness claims. I touched on it a little bit earlier. Terminal illness claim is actually a claim on the death benefit within that person's lifetime because they have two specialists supporting a prognosis, that their life expectancy is less than 12 months. So if you have two doctors signing off on a certificate for that, you can lodge a claim for the terminal illness benefit on the life insurance. In CBUS, it makes a big difference. It's double the benefit of a disability insurance. In most super funds though, it will be about the same amount, but there are a few other benefits. Usually a TPD claim, a disability lump sum claim, will take around 12 months for us, Maurice Blackburn, to get those claims through. For individuals, we've had them come to us after 3 years trying to get a claim like that through. Now, each claim is different. If it's pretty clear cut that you're TPD, obviously that's not going to be the case, but you're certainly looking at a minimum 9-month window to go through that whole process, even when it's a very clear cut claim. With a terminal illness claim, clearly that window needs to be shortened significantly. So you're looking at a couple of months, maybe 3 months, and depending on how severe it is, we have had success in about 3 weeks before, but that was a pretty serious situation. A young lady had terminal cancer and she passed away probably about a week after we got that claim through. But getting that terminal illness benefit for her meant that she could go home and have palliative care in her home, which is where she wanted to be, and it made a huge difference to her end of life. So obviously these terminal claims can have a huge impact. I was asked the question by someone in a similar group actually as to why you would go through that sort of trouble when your family is going to get your death benefit anyway. That money will come to the family eventually. And of course, if you're looking at a very stressful situation where it's not worth it, if it's too much stress or too much trouble to go through that process, then there's no need to. Whereas it can have a huge impact on someone's options for end of life, or even their choice of care, or even the type of treatment they might be able to access, depending on the size of that benefit. So I'm sort of wrapping up here now, and once again I'm certainly open to questions, but I wanted to highlight the role of the social worker at the Alfred Hospital. Something quite interesting happened with this social worker about 9 months ago. She always works in the CF ward, and because of that we've had a significant number of CFers come through to us and get advice or assistance if they needed it in running these claims. But about 9 months ago, one of her colleagues went on holidays for 4 weeks. So to cover, she went to the transplant unit. And in the transplant unit, within 4 weeks, she connected us with 8 patients who all had potential terminal claims or who needed the right information at the right time. Now, those people would never have heard from us if it wasn't for the fact that someone went on holidays and the right person got transferred to their ward. It's about that one person who's thinking outside the box, looking at the situation and thinking, okay, are there other avenues of support here? Obviously, as a social worker, it's on her radar a little bit, but there's so much more going on in that role. But through the successes and through her understanding of the impact it has, she consistently realises the importance of super, and at least having a look, seeing what your options are, whether it's something that will immediately impact you or whether it's something to know because you're going to need to know it in a couple of years. It can make a huge difference. If you're not working in the construction industry, you can still be a member of CBUS. Those industry super funds, they focus on an industry because it's a niche in the market. But you can still be a member if you work in retail, or if you're a barman who would normally be with Host Plus, but you like what CBUS offers, then you can go there. In terms of restrictions on where you can put your super, they really only exist either through an EBA or an employee agreement. There might be something within your workplace which says that all employees of that particular place have to have their super go somewhere, or certainly within the government there can be some restrictions. They might need to be with PSS or whatever fund is assigned for government employees at the time. But for the most part, the vast majority of people can put their money wherever they like.